Good morning, everyone, and welcome to my presentation. Today, I, Rohan Rangi, is here to present a presentation on Advanced Care Planning, or ACP, for palliative patients. Do you know the prevalence of Advanced Care Directive is highest in the residents of residential aged care facilities than compared to the general public in general practice and hospitals? Advanced care planning is the process of planning for your future healthcare. It relates to the care you would or would not like to receive if you were not able to make your own decisions due to the terminal progression of the chronic illness. This often relates to the care you would like to receive at the end of your life. The major focus of my presentation will be on three parts: the effects of ACP on patient and their family satisfaction with care, a comprehensive overview of ethical decision making concerning ACP, and lastly, we will evaluate the requirements for effective communication in palliative care. ACP is linked with numerous positive outcomes for palliative patients and their families during the terminal stage of their illness. As advanced care planning gives patients the opportunity to think, discuss, and record their preferences for the type of care they would receive and the outcomes they would consider acceptable. ACP has shown the improvement in the quality of care at the end of the life and increase the likelihood of a person's wishes being respected. For example, clients' families report greater satisfaction at the end of the life care provided. Moreover, surviving family members reported reduced anxiety, depression, and post-traumatic stress. It helps to ensure your loved ones and the medical team knows what your health and personal preferences are, and these preferences are respected. The ethical reasoning is a crucial tool of ACP, which affects the individual concerned as well as their family, carers, and the medical team. There are many ethical aspects that a nurse can keep in mind, like beneficence, non-maleficence, autonomy, and justice, while discussing and compelling with the Advanced Care Directive with a chronically ill patient. But today, I will only discuss about autonomy and beneficence. Autonomy is someone's right to make their decisions for themselves and express their values. ACP should promote autonomy and the patient's right to control medical decisions making. An advanced care directive extends autonomy to a time there is a terminal progression of one's chronic illness and he or she is incompetent to make their own decisions. This will not only include the medical choices, but also the cultural beliefs of the patient. The other ethical principle I would like to present is beneficence. It is defined as an act of mercy and kindness just for the notion of doing good to others without expecting any reward back. A nurse can do this in many different ways in a palliative setting, like following and adhering to the Advanced Care Directive, giving analgesia to patients on the time to reduce the distress and keep them comfortable. Nurse can also demonstrate this ethical principle by holding a dying patient's hand till the end. This will give overall satisfaction to the patient and his family by promoting the care that is in the best interest of the dying patient. Communication. Communication plays a pivotal role in palliative care nursing. Communication between palliative patients and family and health professionals is the core of a positive end of life experience. True and effective communication helps in the development of therapeutic relationship and helps patients to identify their wishes and support them to make an informed decision about their care. An open-ended question like, how are you feeling? Instead of, are you feeling better? What questions do you have? Or what parts shall I repeat? Instead of, do you understand? Can be a very effective means of communication in palliative care, as it allows them to give an unrestrained or free response. Moreover, Good eye contact and an open posture with the use of layman language instead of medical jargons can make patients feel more at ease. At last, I would like to say that every patient has different communication needs and these may change throughout their illness. So, effective communication is the best tool a palliative care nursing can use. Thank you.